joining us now is Clinton Marquardt.
Hi.
Welcome.
Thanks for having me on.
We've been having lots of conversations, actually. But you know, if we get right to it, if we start with the whole function of sleep, how do we know if we're having a sleep problem?
Well, most of the people will complain about one of two things, and that's one, either they can't sleep or they're really tired during the day.
Yeah.
So the trick there is to try and find out exactly what's going on. And there are two great ways of doing that. The first one is to have an overnight sleep study done.
Sure.
That's where they plaster you for a whole bunch of wires, and then they put you in a tiny little room, and they say, sleep.
Right.
And we're going to watch you while you sleep.
Right.
That's not the most enticing evening for most people.
A lot of people can't sleep because of the environment.
Yeah.
So if you are having a study like that, though, you should bring things that you need to sleep, like a sleep pillow or whatever you need.
Sleep pillow, some comfortable clothing. Now, if that's not an option for you, there's another device out there called the Sleep Advisor. And you can find out more about it on my website, but essentially it's an electronic diagnostic tool. So you simply stick the CD into your computer, answer a bunch of questions, and it tailors the questions as you go according to the answers that you give, and then gives you a sort of a diagnosis or the sleep advisor's impression of what it thinks is going on, and then gives you some solutions on how to fix your problem.
Excellent. Okay, so good information. Now let's talk about solutions. So if a person is having some sleep issues, some simple things that they may try on their own, what would they be?
Okay, so I've got a great list here that's called Sleep Hygiene. It was developed in the late 70s by a Dr. Peter Horry. And we probably won't have time to get into detail of all of these things, but I believe we're going to be showing a list of the sleep hygiene tips as we go. But I'll talk about the first few.
Okay.
Because one of the first things you'd like to do, or you should be doing, is getting rid of that bedroom clock.
Yes.
All it does is gives you pressure to fall asleep. It reminds you that you're not asleep. It reminds you how long you've been awake. Now, if you absolutely need a bedroom clock or an alarm clock, take it and stick it in a drawer. Leave the drawer open so at least you can't see it, or put it under your bed.
Because I was going to ask, how then do we wake up in the morning?
If you don't have that alarm clock ticking away, exactly.
Right,
Hide it so you can't see it. That's the best thing to do.
And I would add too, we're going to talk about electronics, but I would add maybe sometimes even considering going back to the old-fashioned types of clocks that don't have the blaring lights that are shining.
Or the glow-in-the-dark green. Turn that around too, and now make sure if you're sensitive that it's not the old Big Ben style that's tick, tick, tick every minute
good
or
point,
so.
good point. Okay,
another good
else?
thing to do is to limit your time in bed. A lot of people try and maximize the time in bed to make up for poor sleep, and that's the wrong thing to do. What you want to do is have just enough sleep so that you're refreshed for the day, but that you then become tired at the end of the day as well.
Okay, that makes sense, yes. Okay, and so for more of the sleep hygiene information, where can people find out
If
more?
you just type in sleep hygiene on my website, which is sleepandreams.com, it should bring you right to that page.
Okay,
and
good.
I believe I've got 9 great tips listed there.
Okay, let's just finish off with the 9th tip. What's the 9th tip?
So the 9th tip that we've got here is a really good one, especially for people in your area. What we say is, don't shy away from some sort of medication, naturopathic or homeopathic remedy.
Yes.
They have a great place when combined with some behavioral strategies.
Exactly.
So use them the way they're supposed to be used.
Yeah, I find that when people start getting into a rut of having difficulty sleeping, then it just cascades.
Yeah.
And usually what I like to give people as a guideline is that if they're having more than 3 nights in a row interrupted, then that's when you really do want to follow up and start trying this sleep hygiene, as well as maybe following up with a professional.
And at 3 days is what we look at in the behavioral sleep medicine world too. So that's perfectly in line with what we say.
Okay, so we're cohesive here. Okay, I know lots of people are interested in dreams. The big question, what exactly is a dream?
Well, it depends on what theory you're listening to
Yeah.
and what books you've read and sort of the slant that you've come from. The slant that I come from is a biobehavioral perspective. And the way we see things is that we understand dreams are essentially your brain trying to make sense of random neuronal or brainwave firing in the middle of the night.
That makes sense, because I know that in terms of the location of the brain of where dreams come from, it's the cerebral cortex, and that's where we have a lot of our reasoning. So it's like if we can't figure something out in the day, then our body will try and work it out at night.
Yeah,
Would
and the way dreams start is in an area of the brain called the pons, which is kind of behind the cerebral cortex. But what happens is that area of the brain fires, and that electrical stimulation spreads to the cerebral cortex, where the brain then has to, as you say, put that story together.
Yeah.
Now, the interesting thing is the way it puts that story together can sometimes tell you a bit more about the person.
Absolutely. Lots of information about dreams and what it relates to in people. Okay, so then if we understand the why and the what, then we want to start taking a look at the question about babies. Like let's talk about ages and how dreams affect different age categories. Do babies dream?
Well, it's hard to know because you can't ask a baby if they dream, right? So,
Right.
so how do you know? Dreaming is a mental phenomenon, but it is related to REM sleep, which you discussed in your introductory section.
Yes.
And REM sleep is where we dream most often. And I think you said if you wake somebody up from REM sleep, they'll normally recall a dream.
Sure.
8 out of 10 times they will recall a dream. Babies have a ton of REM sleep.
Yes.
So it's quite likely that they do
do
dream.
And we were talking about the fact that this whole science of sleep and dream analysis is perhaps more towards the newer side. 30 years, I think you were saying, something like that?
Yeah. Dreams have been studied way back since Freud. So we're
Yes.
talking 100 years or so.
Yes.
But as a medical behavioral science, sleep and dreams has really only been around for 30 or 40 years. So we're still learning about dreams, what they mean, what REM sleep means, and why we sleep.
Absolutely. Now, as we move on, children. So how are children's dreams different and teenagers' dreams?
Teenagers and children's dreams typically differ in the content of the dreams. Depending on what they're going through in that stage of life. So if you're talking about children, there's often toilet training, going to school for the first time.
A lot of stress for a little kid.
Yeah. And you think of what's going on in a teenager or an adolescent, it's about relationships. It's about difficulties at school.
Yes.
So the content does change a little bit as you progress through the years.
And as I understand, it's also in the context of their world. So a child is more likely to dream about animals and or that type of thing, whereas teenagers, perhaps there may be a car involved or something like that. More interpersonal relationships, I would imagine.
And as we've talked about, it's such a new area, really, the sleep and dream side of things, that what we think is going on is that you dream about things that are of a concern to you that day. So you're quite right. Yeah, it'll really reflect what they're going on or what's going on in their day.
Thank you so much, Clinton. We're going to be back with Clinton, and he's going to answer lots more of our questions. So what did you dream about last night? What does it mean? Continuing on our questions, we are here with our discussion portion of the show, joined again with Clinton Marquardt, who is an international sleep and dream consultant for over 20 years, and medical and naturopathic Dr. Shirama Euclide, who has also studied homeopathy for over 20 years, and is the founder of Integral Health Clinic in Ottawa and the Canadian Homeopathic Institute. That's a lot of expertise. To add to that, I recently received a call the other day from the Naturopathic Association asking if I'd be attending the convention this year, as they wish to give me a special tribute. I was thrilled, of course, to say the least, but when I asked what the award was, I was told that it was the Elders Award. Yes, I too have been practicing for over 20 years. So there you have it. Between all of us, we have 60 years of clinical experience. So continuing on our discussion of dreams, finishing up for homeopathy, how can dreams be used in your follow-ups to help assess which remedies are working?
Well, dreams are a very important manifestation of what is happening at the subconscious mind of the person. So when I treat a person, I really like to see that everything about the person is healing and is improving. So during the follow-ups, I really like to see that what a person used to dream about, for instance, failing an exam, that it is improving. If the treatment that I'm giving to a person is working at a very deep level, I like to see a shift in the dreams of the patient.
So ultimately, a person is not is doing better on their
this is a very
late for exams.
Exactly. Yeah, it's very important for me to see that the sleep of the person has improved greatly, because it's a very important indication of health. But also to see that the recurring dreams that they have are being resolved more and more. And then I know that we're working at a very deep level at the person.
Exactly. Memory. Okay, everybody loves dreams. How do we remember our dreams more?
The trick is a behavioral one. most people don't remember their dreams because they've forgotten how to do so. So you can introduce techniques to help them remember them. The first thing you want to do is get a dream journal. Keep it beside your bed, and this would probably help you in your diagnosis
Yes.
as well, and you can probably use them as well. And the moment you wake up, what you want to do is take that dream journal and just write something in it. If you can't recall a dream, just pretend you're recalling a dream and write something about that. And then you would slowly learn that pattern, and your brain will help you learn to recall dreams
That's a good
better.
trick.
Yeah.
I like to encourage people, if they can't remember their dreams, I'll ask them to imagine. So I'll ask them, if you use your imagination, what's the best dream you can remember? And if you're using your imagination, what's the worst dream? And then that will actually stimulate them
Yeah.
to actually remember their real
Exactly.
dream.
Anything
Yeah.
you can do that practices that dream recall bit, whether you're awake or asleep, will help. Yeah.
Exactly.
I often ask my patients who say, I don't remember any dreams, I would say, well, what would be your worst nightmare? Make it up right now. Or what would be
Exactly.
your best dream? That gives me an idea of what is really happening inside the person.
Speaking of nightmares, we have an email question, and one of them is, of course, the dream. Is it true that when you dream that if you die or hit the bottom in a falling dream, you will in fact die in your sleep? Is that true?
How would you know, first of all, right?
That's true.
But I don't think it is, no.
Sure.
There's been no proof, no research that has said that if you do something in a dream like that, it happens to you in real life.
I could talk about personal experience. I actually
Sure.
have dreamt about dying. And in
Oh,
at
interesting.
least 3 times in dreams I dreamt that I died, but
And
he's
you're
up-
still
and he's
here.
still with us. He's still with us, yeah.
so
And what significance do you think that is then, if you had had the dreams multiple times?
I think for every person it has a different meaning. It may be just curiosity about what is it like to die,
Yes.
or it's maybe any other preoccupation, or maybe I watched a movie about somebody dying, and then
Sure.
in that night I became that person.
So I think that brings up another interesting thing that we were talking about, the fact that everybody wants to have a dream analysis,
Yeah.
can you just tell me what this means?
Right.
And the whole concept of dreaming of a dog means this, that's not really the case, is it?
No, well, if you think about what the brain is, it doesn't change when you sleep. When you're awake, you're not really thinking in those discrete symbol forms now, so why would you do that in a dream?
Exactly,
Yeah,
exactly.
It's a very old notion.
Now for parents, of course, parents are always worried about nightmares versus night terrors. What is the difference?
Nightmares occur during REM sleep, so there's often dream content associated with them. Night terrors, or as we call them now, sleep terrors, are a non-REM phenomenon. Child will sit bolt upright, scream, and when you ask what were you dreaming about, they won't recall a dream.
Yes.
It happens in a different stage of sleep.
What about, thank you, that brings in sleepwalking, because some people do that. What is that?
Sleepwalking is another, we call them parasomnias. They occur in non-REM sleep, and it's essentially part of the brain wakes up and starts the person walking, talking, some places sometimes eating.
Great conversations.
Yeah, great conversations, but it really has nothing to do with dreaming.
But
Okay.
in homeopathy, there are specific remedies that are used for night terrors,
Yes.
and other dreams for nightmares, other remedies for nightmares, and there are specific remedies for sleepwalking or sleep talking. So each one of those really is an indication of some kind of imbalance in the system from a homeopathic point of view. So it's really important to see what it is and how does it relate to all the other symptoms of the patient.
Exactly. Of course, another type of dream would be premonitions. What about premonitions? Do we have the ability to have those?
I think in some ways the brain can put together things that it's learned and picked up and come up with something that might look like or sound like a precognitive dream.
Sure.
But for the most part, dreams aren't future tellers, really.
Exactly.
Or fortune
yes.
tellers.
Or more investigation needs to be done,
Yeah.
perhaps. I know that there was a good friend of mine. She was pregnant. She was having difficulties in the delivery process. We were at the hospital. We came home, went to sleep. At 3 o'clock, I sat up in bed and I said, "What time is it?" And my husband said, "It's 3. Go back to sleep." And I said, "She's had her baby. Everything's fine." And I went back to sleep. and I was having some type of, again, we can be connected to people. We hear about this through twins.
Yeah, and maybe your
things
brain
like
put
this.
things together throughout the day or the last month that made sense for her to have that baby at that time, and you picked that up.
Absolutely, could be that as well. We have another question. At what age, just going back to nightmares and night terrors for a moment, so as a parent, how can a parent tell the difference between the two?
Between
Nightmares and night terrors.
Okay.
So scientifically, they're occurring in different stages of sleep.
So if it's occurring during the beginning of the night, chances are it's a night terror or sleep terror. If it's happening during the latter half, last third of the night, then chances are it's a nightmare.
Okay, good.
Yes, I think the intensity also of and the way it affects the person is a very strong indicator of, is this a terror? Is this the person really terrorized from and is screaming and inconsolable?
Right.
Or whether they're very easy to calm and put back to sleep.
Exactly.
Usually a night terror is very much harder to deal with.
Yes. So one of the other questions that was emailed to us is it possible to control our dreams?
There's a phenomenon called lucid dreaming.
Yes.
And yes, it is possible to control your dreams. It's a difficult thing to learn, but once it does happen, it's a really, really interesting and exciting experience to have. Yeah.
If somebody wants to manage, let's say for example they are experiencing a nightmare and they do want to work at trying to change it, how do they start taking steps to do so?
Maybe you want to feel
I have seen patients that after I found the right remedy for them, they come back and say, I had that nightmare and then I realized it's a dream. And that was the healing effect of. So they were able to dissociate themselves from the content of their dreams.
Absolutely.
And this is a part of their healing.
And I
process.
have certainly observed that as well. My father has dreams about the war. And it is a reality. He went through the war. But that will come back when he is stressed and when he needs his remedy again. And when he's given Kaylee Cyan, his dreams go away, he becomes much calmer, and his overall health is much better. So that's one example of how homeopathy can play. Okay, people talk about dreams being in color. Are dreams in color?
If you look at the research, it'll show that people report color in dreams about 1/3 of the time. So 30% of the time people recall a dream. Now, if you get them to pay attention to color, they'll report color in dreams a lot more often.
Excellent.
Yeah.
Thank you so much, both of you, for joining us. You're both very interesting, lots of great information, and we can find more information on both of your websites, which we've posted.